Rhode Island Healthcare is broken. Rhode Island faces severely limited access to primary care and specialty providers, crumbling healthcare infrastructure, and hospital bankruptcies, acquisitions, and closures. We are urging you to support the Senate and House healthcare bills by emailing your local legislators today with an easy-to-use template at southcountyhealth.org/support. Take action today and join our community in the fight to save Rhode Island healthcare.
Senator Sosnowski, who is busy but is able to break away from her in the room adjacent to ours. She's chairing the Commerce Committee, but finds this as an important piece of legislation and is bowing out long enough to present Senate Bill 2722. Go right ahead, Senator Sosnowski.
Thank you very much, Mr. Chairman and members of the committee. I want to thank you all for allowing me to testify on 2722. I also want to thank the Senate President and the Majority Leader for including this bill in the Senate Rhode Island Health Initiative legislative package. Last year, I introduced similar legislation that only addressed reimbursement parity for Rhode Island physicians. But this year, after attending a presentation at South County Hospital, along with other local senators and representatives, and listening to the explanation, seeing the data, I gladly introduced this bill at South County Hospital's request. I'd like to thank my fellow sponsors, Senator Pearson, Miller, Valverde, Lauria, and DeMario. What the bill does, it amends sections of the Rhode Island Healthcare Reform Act of 2004. It clarifies purpose and adds definitions to protect solvency of our health systems, physicians and advanced practice providers, as well as insurers. It encourages fair treatment of our hospitals, ensures adequate clinical workforce, and advances health equity. It defines a health care competitive region of Massachusetts, Connecticut, and Rhode Island. It establishes a requirement for reporting of a regional average rate based on hospitals, physicians, and advanced practice providers in Massachusetts and Connecticut. It establishes a regional parity floor to be achieved over 3 years, whereby 2028, hospitals, physicians, and advanced practice providers are paid materially equivalent rates to average payment rates in Massachusetts and Connecticut. And it creates the contract opener in the first year of enactment if rates fall below 33.3% of regional average rate. Why is this, excuse me, why is this bill important? I think we all know, all of you in this room, I'm sure know, that we are unfortunately losing doctors and nurses to neighboring states. If I can just share just a couple of points from emails that I have received from constituents. One says, Rhode Island competes in a region that includes Massachusetts and Connecticut, where hospitals and healthcare providers enjoy 20 to 30% higher rates of reimbursement. This is the root cause of the aforementioned bankruptcies and deteriorating infrastructure, but it has also created an inadequate healthcare workforce where Rhode Islanders regularly struggle to find primary care physicians or get timely appointments with specialists. This person actually goes on to say that the Association of American Medical Colleges, or AAMC, Rhode Island ranks 47th out of all 50 states in losing physicians after completing medical training. Another constituent wrote to me and said, I quote, "I recently lost my PCP, primary care physician, at my age of 75, and he was the best one I ever had. I only had him for 2 years, and now I am lost as to who I'm going to turn to. He recognized the potential for a serious medical condition during my annual exam in November of 2022 and sent me for some tests. Sure enough, the tests confirmed he was right, and now I'm on a course of good care with a specialist at South County. But my issue is, where do I go to find another gem like that doctor? Unfortunately, the best doctors in the South County system are not taking patients right now. So, I'm sure my colleagues on this esteemed committee are getting the same types of emails, because this is not just a South County issue. We are losing our doctors, which results in fewer medical options for care. In addition to the AAMC data that I mentioned, I came across some information on Wallet Hub. The studies rank Rhode Island's second worst state for doctors. Unfortunately, I hate to share this information, but the data range from average annual wages of physicians to the number of hospitals per capita, and I'm sure the cost of living is higher than Rhode Island than most. Hawaii is the worst, by the way, they rank. And you know, that's an island. We have competition right over the state line, so it makes it more critical. So, in closing, I know you have lots of distinguished witnesses to speak on this bill, but I really want to take the opportunity to thank every doctor, nurse, lab tech, hospital worker who works for us in Rhode Island. I have to say, especially the folks at South County Health. Without a doubt, they saved my husband's life. We need to pass this bill for every baby that will be born, every person who needs joint replacement surgery, cancer patients, cardiac, pulmonary patients. For our state's future well-being, I implore you to pass this bill. It's such an important step for Rhode Island's healthcare survival. Thank you.
A brief introduction on my behalf. I am the president of Maxon Automatic Machinery Company based in Westerly, Rhode Island. Now a fourth generation family business. We are in the capital equipment market, and because it's a family business, we have a rather parochial way of treating our, a paternal way of treating our employees. We pay 70% of the healthcare benefits, both healthcare and dental, and so we're keenly aware of the cost of healthcare, but also its accessibility, and we work very closely in that area. I'm also the Chief Volunteer Officer of South County Health as the board chair, and I come to you today on behalf of the Board of Trustees for South County Health. We support this legislation not because South County Health is sponsoring this and has put together the legislation, but we do it because we're Rhode Islanders. This is throughout the state, regardless of the healthcare delivery system or the physicians that happen to be associated in the healthcare business. We are concerned about the accessibility, in particular, the accessibility of quality community health care. I'd like to cite two examples of things that we're doing at South County Health over the last few years. One of the areas that the board identified along with management was the percentage of compliance of those who should be having colonoscopies. It was in the mid-30s. We invested through philanthropic gifts, a new endoscopy suite, and we developed a strategy with our primary care physicians and working with Rhode Island GI, a subcontracted service, to try and deal with this on a public health matter. And I'm pleased to report we've moved that from the mid-30s to 70%. That's what a community health care system provides. We're doing the same thing with mammography. Again, post-COVID, looking at about a 30% compliance. And again, working with our primary care physicians and our internal workforce, we are creating a breast health center that, again, will be funded by philanthropy, and we are now moving to about a 70% compliance. This is not without cost. Between contracted services and our own physician group, South County Health is running about a $25 million deficit. That is to say that we invest because we do not get sufficient revenues. South County Health, the only independent healthcare system, the only hospital in Washington County with a birthing center, has revenues that do not exceed $250 million. And I sit here as a member of the Board of Trustees to tell you that the board has determined that that is unsustainable. We cannot continue to do this. And we are now being put in a position to start making hard decisions about what we can do and do well as a community health provider. So I want to thank you for your time. This is important, not just to Washington County, but to Providence County, to Kent County, to Newport County, and to the northern Rhode Island County. So I thank you for your time and your consideration.
Thank you, Joe. Okay to go ahead?
If there are any questions for the chair from the committee. Thank you. Senator Ujifuza?
Yeah, I was just wondering, you said you're running a 25% deficit. Could you
$25 million.
$million deficit. Could you identify
The deficit is in the subcontracted physician cost and subsidizing our own cost for our physician group. And that's driven primarily, I hope I'm answering your question now, driven primarily because we have to subsidize these because of the salaries that we're seeing in Connecticut, which is, 12 miles away to Connecticut and also into Massachusetts. So we have to pay, even though we're not seeing the revenues that are coming in. We believe this third-party reimbursement will help us in resolving that.
so the shortage is arising from the fact that you're not getting enough from third-party payers. Is that right?
Or for Medicaid or for Medicare. But typically, in the healthcare industry, and I'll defer to the CEO, Aaron, but typically we rely on third-party reimbursements, which are higher than Medicaid and Medicare.
Yeah, just to give you a little, if it's okay, if I may. So in 2019, our investment or loss, if you will, on the employed physician practice and our contracted physician services was around the $8 million range, and now it's $25 million. It's gone up 66% in less than 5 years. Because physicians, anesthesiologists, emergency providers, GI providers, we have to cover call 24/7. They have deficits in their reimbursement as it compares to what it costs to provide the service. So they come to us to fulfill that gap. So increasingly coming to the hospital to fill the gap the Rhode Island reimbursement doesn't fill. So we're underfunded as a state, 20 to 30% in commercial, 15 to 20% in Medicare, and similar amounts in Medicaid. So all three legs of the stool were underfunded in Rhode Island, whereas drugs, doctors, nurses, all the input costs are the same in Rhode Island as they are in Connecticut. The drug costs you heard earlier don't somehow become less expensive when you come across the border into Rhode Island. So our input costs are the same, but our revenues are dramatically reduced. So that's the unsustainable part.
So before you start officially, I want to say that if every once in a while in the last several years, I've sounded like I know what I'm talking about when it comes to healthcare, it's because I listened to one of your predecessors, Lou Giancola.
Oh,
So I have to, when I have the appropriate context, I want to bring up his name and thank him. And
likewise. Great man.
yeah. Mr. Robinson, go right ahead.
Thank you, Mr. Chairman. I want to thank every member of this committee. I want to thank the Senate for bringing forward this incredibly important issue. I'm not originally from Rhode Island, been here for 5 years. And from the moment I got here, what I heard from patients, community members, and providers is this has been an issue forever in Rhode Island. And so everybody knows that you paid less in Rhode Island, that unless you were born here or your spouse is from here, you don't practice here. That is our best recruitment strategy for primary care physicians and specialists. Absent that, we struggle to recruit and retain. That's why you heard Senator Sosnowski say, we're 47th out of 50 states in retaining graduates from medical education, because doctors know this, right? Nurse practitioners know this. So from my perspective, I'm the least important voice here tonight. Joe is the chief volunteer officer. He volunteers his time. He's a community member. All the clinicians here, I'm proud to say we have over 10 physicians, advanced practice providers, nurses here taking their time to tell you how important this issue is, because they see it every day. And I also want to talk about community. So the number one issue for South County Health is accessibility. We cannot provide community health without being accessible. You heard from some of Senator Sosnowski's constituency, they can't get in to see providers. We can't recruit or retain physicians. Over a third of primary care physicians in this state are at or near retirement age. So if you have a primary care provider, you're about to lose them, or they're not taking new patients. The Attorney General, I think, got it right when he said, if every third gas station you went to was out of business, people would freak out. 4 out of every 5 gas stations were out of business. You'd really, really freak out. That's what it's like trying to get into a primary care physician in the state of Rhode Island. 18% are taking new patients, and the wait is 6 months to a year. We've lost many providers to retirement, to Connecticut, to Massachusetts, and you'll hear tonight how difficult it is for us to recruit and retain advanced practice providers and primary care physicians. We understand the issue of affordability, just like we understand the issue of affordability for milk or gas. But what we've done in Rhode Island is we've said gas stations need to buy gas for $5 and sell it for $3. Those gas stations would go out of business and would lead to an insolvent health system. We have the Office of the Health Insurance Commissioner, my esteemed colleague here, who has a statute that requires many focuses. That statute requires focus on affordability, but it also requires focus on access, quality, resiliency, sustainability. It requires all of those things. But a unilateral focus and a myopic focus on affordability has created innumerable bankruptcies in this state by underfunding the healthcare delivery system and leaves us on the brink of collapse. You all know Roger Williams, Fatima are on the brink of collapse. Care New England has less than 40 days cash on hand. We have fragile health systems with decrepit infrastructure from decades of underfunding, held together by duct tape and baling wire. And I wanted to say that this issue is an access issue, but it's not an access issue for people in this room. It's not an access issue for me, because I know people, right? This is a health equity issue, because guess who doesn't know people? The people outside of this room, the people in the community. The number one call I get is, can you get me into somebody? And I'm running out of options. I'm running out of bodies. And my clinicians are consistently put in the middle of that, trying to figure out who they can see, how they can fit one more person in. And the root cause of this is underfunding. We support affordability. We support alternative payment models. You'll hear folks talk about global budgeting. Are there alternatives that can create different incentives for the delivery system in the long run? Absolutely. But when you're 20 to 30% below the competitors that are competing for your talent and have the same input costs that you have, you've got to rebase before you consider any alternative payment model. And we understand affordability, but we exist in a market economy, and incomes don't really affect the price of milk. They don't affect the price of gas. There are input costs that drive those costs in a free market. And if you're going to have resiliency, sustainability, we have to have adequate reimbursement and a level playing field. So you're also going to hear that premiums are going to go up way too high. Our calculations suggest that with this 3-year ramp, those premiums will not increase any higher than neighboring states. In fact, they'll still be significantly lower, both at the large employer, small employer, and individual level. You're going to hear higher and draconian predictions, but this creates resiliency and sustainability. So I strongly urge your support in passing out a committee of Senate Bill S-2722. I want to thank Senator Sosnowski for her leadership and those that are signed on in support of this bill. So I'll take any questions.
So there is a version of this bill I support, and there's other bills that I support, but I want to put it in the context of what we hear in this committee and bills we have already heard. Like last week, we heard a series of compact bills that would include Rhode Island in a series of provider compacts that currently Rhode Island doesn't participate in, as an example. Also, we will, if we haven't already heard, bills around scholarship and tuition and increasing access for scholarship and tuition. I bring that up because you talked about our ability to retain
Absolutely.
or attract Rhode Islanders. And I just reviewed a bill in the House that would add $1 million rather than zero to tuition assistance.
That's great.
Versus, it's great, but it's not going to make, I mean, you talk about parity with Massachusetts, similar program over $120 million.
It's drop in the ocean. Anything helps, but it's a big gap.
Yeah, so I just in the context of what you're talking about, and this committee probably knows better than a good amount of other people in the building how important what this bill would do, but we also know it's not this bill alone.
Absolutely.
As what we need. I mean, I'm almost embarrassed by the 1 million versus the 120 million if we're going to retain or attract people who are coming out of Brown Medical. But it doesn't only have to come out of Brown Medical. As another example, Delaware has no medical schools, but they pay per positions in adjoining states. We have to do better than less than 1% of what Massachusetts is doing. It's not only these rates, it's a lot of other tools that we are not taking seriously.
Amen.
So I appreciate your comment, but it's a frustration of not only myself, but members of the committee.
Thank you for those comments. And I would also just add, on the reciprocity bills for licensure across state boundaries. I think it's a good step in the right direction, but absent parity, it will encourage and make easier that out-migration of clinicians from this state to another. So I think your point is well taken, that it's a package that goes together. And so passing that bill with parity allows for better retention.
Yeah. Senator Lauria?
Thank you, Chairman. Are you aware of the CTC and the work that they're doing around primary care?
Yes.
Are you aware of their statistics that they predict that by 2030, about approximately 20 to 25% of Rhode Islanders will be absent a primary care provider?
Yes.
And so
Probably conservative.
that's probably conservative. I agree with you. I'm a primary care provider. I'm a nurse practitioner, and I everything that you said just rings so true to me. I can't tell you how many times I've been asked, "Can you take so and so? Can you take another patient?" I have patients, and I'm sure this is not unique to myself, that have been in the last 4, 5 years through 2, 3, 4 other primary care providers, because that keeps happening to the same people.
Absolutely.
So
Same
those
thing.
people are not included in that statistic of 20 to 25%. But the beauty of primary care is that you develop a long-term relationship with somebody, that you know them. You know when something's wrong. You know their history. You walk in the room with a wealth of information that can't happen when they're forced to either continually have a new provider, or even worse, they don't have a provider, so they end up in an emergency room. Is that correct?
We see patients in our emergency room every day that would not be there if we had adequate supply of primary care. You heard behavioral health earlier. We need adequate supply of behavioral health, primary care. And behavioral health is primary care, and so that lack of adequacy causes higher utilization in our emergency rooms, and that's the last place that these individuals need to be seen. But that's where they are being seen because there's no other option.
And the cost of providing care in that setting is far higher, both to
Far
the
higher.
individual, to the insurers, and to our system. Is that correct?
Yes, it is.
And if you had to say, so I actually have the 2 bills that are talking about trying to recruit primary care providers, either through having adequate places for them to train or through scholarships to entice them to come back to Rhode Island and practice here. I consider that a medium-range solution. Can you think of anything, because this problem is not a medium-range problem, correct?
No, it is it's a near-term, mid-term, and long-term issue.
But it's happening right now.
It is happening right now.
This isn't a catastrophe that we're looking at in the future. This is a catastrophe that's happening right here in Rhode Island.
I think,
at this moment.
I hear you all raising the flag. I don't think folks in the general public know how fragile the healthcare system is. They know they can't get in, but they don't know how very fragile the healthcare delivery system is, that's been created over 2 decades of underfunding. And you have 2 major hospitals go out of business. There's no capacity to service those patients moving forward. So we're on the brink of crisis.
And so can you think of anything in the very near term that we can do as a state and as a legislature that has more impact than increasing the rates so that we can keep our current healthcare force, maintain our infrastructure with our hospitals and community resources, than raising the rates that this bill suggests?
No.
Thank you.
Senator Morgan?
Thank you, Mr. Chair. Now, I've heard from my doctor that it's a lot of the overregulations that we are infringing upon our doctors. They're leaving because they are overregulating them in a lot of different areas. I myself, this last year, there were 2 instances where I had to see 2 separate specialists. I ended up having to go to Boston because
Yes.
one of them was, it was something I needed to see. It wasn't something I could fool around with.
Wait.
And I got an appointment within 3 days in Boston.
We hear the
So,
same thing.
I think that our General Assembly is over-regulating our doctors also, and that's what I hear from my doctor. I don't know if it's money, if it's...
Well, when you look at those rankings, so the advisory board, many of you that are in healthcare know the advisory board is a preeminent strategy organization for healthcare. They rank Rhode Island the worst state in the nation for physicians to practice medicine. It's not just because the pay is low. It's because the malpractice environment is horrendous. There are no caps to malpractice awards to physicians. It's a scary place to practice. Our CON threshold is about 1/20th of a certificate of need. So we have this overburdened regulatory environment that makes it hostile for healthcare providers and physicians to practice in. Not to mention that, oh, by the way, you're going to get underpaid and overworked because there aren't enough of you to go around. Hey, you want to sign up? No, they don't.
We're forcing them out by the regulations, paperwork, and all. They can't doctor anymore. They have to, and I don't know, throwing money at it is going to solve that.
Well, it's one piece. There's no silver bullet. But the underfunding of this system is the root cause of our loss, our vacancy, and our sustainability. Believe me, we could talk all night about all the components that need to be fixed. I think the regulatory environment is one of them. I think regulation, when applied appropriately, is good. It's a good thing. But I think we've over-focused on one component of regulation at the expense of, and myopically for, the sustainability of the health system. So.
Thank you.
Senator Ujifuza.
Thank you, Chairman. I'm just wondering, my husband's been a primary care physician and internist for over 30 years, and we're not talking about the recruitment side now. We're talking about retention. He's 65 years old, and he's not leaving. He's leaving for primarily one reason. He spends 2 to 3 hours a night doing paperwork required by the insurance companies,
Yes.
not by our government. So I'm just wondering if that could help with
We call it
retention.
pajama time, and so, the insurers are, so there are winners and losers in this regulatory environment, and top 7 insurers, had $1.5 trillion in revenue, $80 billion in profits, and Medicare Advantage is an issue.
Thank you.
A lot of health systems are going non-par with Medicare Advantage because of exactly what you're talking about.
Right.
Denials, denials, denials. We are in litigation with 2 of the major payers in this state because they underpaid us, continued to deny, and we're in arbitration, and the arbitrators sided with us, but you got to keep fighting. And it's exhausting for providers who are trying to keep up their overwhelming patient panels. And that's where the burnout comes from.
Thank you for your service. I look forward to working with you all on that.
Thank you.
Committee for the opportunity to speak today. I want to speak in support of Senate Bill S-2722. My current role is Chief Medical Officer at South County Health. One of the most important responsibilities I have in that role is recruitment and retention of physicians, which we've talked a little bit about here today. I will say, prior to being the CMO at South County, I was the Chief of Pancreatic Transplantation at Rhode Island Hospital in Brown for many years, and was the Chief of Liver and Pancreatic Surgery. So through my experiences, I feel I have a very in-depth understanding of the Rhode Island healthcare landscape, from tertiary academic medicine down to community health. And I think, as you've heard both from Senator Sosnowski and from Mr. Robinson and others, it's really challenging to recruit and retain provider talent, physicians, PAs, nurse practitioners, midwives, et cetera. I'll tell two quick stories. I want to be respectful of the committee's time because of the number of people that are here to testify. A few months ago, it was probably 2 months ago, we were recruiting a nurse practitioner to help improve access in our wound clinic for people dealing with chronic wounds. We identified a fantastic candidate. She had ties to Rhode Island. Great education, had experience through her education in wound care. Interviewed very well, came out as a top candidate. She messaged that we were a top choice of hers because we had a program to mentor new nurse practitioners that she really liked. She ultimately took a job just over the border in Connecticut because we just couldn't compete with the salary offer. And so despite the subsidies that we're infusing to try to keep up, there is a limit beyond which we feel responsibility is such that we have to kind of hold back from, and recruiting's, can be a really challenge. And we're seeing a brain drain of really talented people choosing either not to come to the state or to leave the state. One other story, serendipitously, I had a conversation with a physician today who's a specialist. Unsolicited, he went into a conversation. He's been practicing in the state for almost close to 4 decades now. And he started talking about the fact that he advised his son and his friends who are his age in medicine, who have children graduating medical school and residencies and fellowship, they're advising their kids not to come back. Now think about that. I mean, they want their children back for family reasons, but they're encouraging them not to come back here to practice. And it's not just about fair salaries. You heard in one of the earlier bills that was debated when Dr. Klipfelt was giving her testimony, she talked about having access to that PRN tool decreased her burnout, right? Some of this isn't just about provider salaries. It's can we put the tools in their hands that they need to take good care of patients every day? And the answer is no, right? Mr. Robinson talked about the fact that the average age of plant for hospitals and health systems in Rhode Island is significantly higher than the national average. That means that we don't always have access to the latest and greatest softwares or technologies or those things that allow all of these people to do the great work that they do every day. And for them, that drives burnout. That's an incredible driver of frustration and burnout, and really hurts our ability to retain that top talent. So some of this desire not to be in the state practicing is not about what people are making. It's about, are they put in a position to provide good, high-quality, safe care daily? And when they're not, as you heard from Senator Klipfelt, and I'm sure you'll hear from some of my colleagues, it's very difficult as a physician and as a provider. So again, I thank the committee for your time and really strongly urge you to consider supporting Senate Bill S-2722. It's very important. We really need your help.
Any questions? Go right ahead.
Good evening, Senators, and thank you. My name is Dr. Brian Kwiatkowski. I've been a family physician in Rhode Island for 25 years. I currently serve as the medical director for primary care for South County Hospital. Many of the points I was going to bring up I've already brought up. Aaron and Senator Lauria had an excellent exchange of where do patients go when they can't find a primary care provider. The emergency room and urgent care centers are where they go. And as this grows, these urgent care centers and the emergency rooms are beaming with business. And as more patients go, the cost of healthcare is going to go up in the state of Rhode Island. Constantly looking for help. We're constantly looking for primary care help, APPs and physicians. It's a very small pool of applicants. If we're lucky to find somebody and I'm able to hire them, I've got over 5,000 Rhode Island residents currently who do not have a primary care provider that were affiliated with South County Medical Group. We have to choose who gets to see the new provider and hope that in the interim, no other provider leaves for Rhode Island or Connecticut where they can gain a higher salary. It's very important that we get rate parity. You know, one other point I was not going to bring up, but I thought of as I was sitting here was what's happening to the primary care doctors in Rhode Island. I was in private practice for 16 years. I I think if I stayed in private practice, I would have been very tempted right now to become a concierge physician. And you're going to see that as an extreme growing trend right now as these providers try to survive in a lower paid atmosphere. If you're not familiar, a concierge physician probably carries a panel of around 400 patients. Most of us carry a panel of around 2,000 patients. So to convert your practice to concierge, you need to ask 80% of your patients to leave, and they have nowhere to go. There's no primary care physician accepting patients. In addition, those patients they're cornered. They need to accept these concierge situations where they pay an extra $300 a month for the right to keep the doctor they already had on top of their high premiums, on top of their high deductible plans. Rate parity and allowing a strong primary care workforce would go a long way to improving the health of Rhode Island. Thank you.
Ladies and gentlemen, thank you for your time. I understand your patience, and we have our patience, and I will be very brief and not repetitious. I could say it in just a few words, as we said when we were in college before cell phones. Mom, send money. I've been involved in healthcare reform health insurance reform at the federal level for about a dozen years. We had white coats at the White House, so this is nothing new. You've heard from my esteemed colleagues and our administrators that healthcare reimbursement in Rhode Island is at the critical level. And I could speak personally that there is no easy solution. We understand budgets, but things like concierge medicine, where I practice in South County, which is a relatively well-to-do area, that won't fly. The people can't afford that. And without an increase in direct healthcare reimbursement with a bill like this, you'll reach a critical point where physicians won't stay. You mentioned that Harvard has a $100 million endowment for tuition. In the borough of Manhattan and the Bronx, if you go to medical school, tuition is free. We don't expect you to be able to provide for that. We do have a philanthropic community, and thanks to them, I have a state-of-the-art radiation oncology facility. Without that, I don't think the hospital could afford that. But we want to practice state-of-the-art care. We don't want gold-plated care. If you go to New York City, you see hospitals that look like Grand Hyatts or Ritz-Carltons. We can't afford that. But if you look at South County Hospital, and some of you have toured it, it is an aging, decrepit building, and without continuing investment, we can't take care of our patients. So I don't look at this as an expense. I could send you all the documentation that you like to demonstrate that investment in primary care saves the system money. And we used to look towards our colleagues in pharma and think that they were where the money was going inappropriately, follow the money. They have come out with more blockbuster drugs in the last 3 years than any of us can keep up with. There is excess administrative overhead, we all agree. And yes, I go home at night and have to deal with peer-to-peer to get the insurers to approve radiation therapy. I could tell you, we don't give radiation therapy to people that don't need it. That would be a crime. It's not like, oh, you don't look good today, we're going to give you 6 weeks of radiation. We deal with the system we have, but without additional funding, the system will collapse. Thank you.
Mr. Chairman and Senators, thank you very much for listening to my testimony. I'm nowhere near as erudite or entertaining as Dr. Fass. My name is Joe Brady. I'm a general surgeon. I've been a general surgeon in Rhode Island since 1993. I served 23 years at Kent County Hospital, and I've been at South County for about 6. The only thing I wanted to do was share a very brief, hopefully brief, patient vignette to point out what happens when we don't have enough access to health care. And what I'm going to describe is not rare. In fact, in the past 2 months, it has happened twice, and most recently being just the Friday past, just a few days ago. The first real touching vignette that I wanted to tell, I met a 31-year-old lady who had delivered a baby 2 days prior. She was still in the labor and delivery unit, and she had suffered an abdominal catastrophe, essentially. And I operated on her, details aren't that important. She did okay for a while, and then she suffered a complication involving something that required care that we are quite capable of providing at South County Hospital on a Monday through Friday basis, but not Friday night at 5 o'clock. And I had this young patient with a new baby, and I had to try to find the care that she needed. I have friends in the surgical field at various hospitals. I called them up and was practically pleading with them. It was not, surgeons would take the patient. The hospitals were, quote unquote, full, could not accept patients, could not accept trans. I went from Kent to Roger Williams Hospital to Rhode Island Hospital, could not get anyone to take care of my patient. I was ready to put this 31-year-old female with a new baby on a helicopter and send her to Yale New Haven. And it was, what she required was not something exotic. It was something that we could not provide at that time because we were short-staffed. The physicians were willing to help. To my left is our Director of Surgical Services, Andrew Sharp. He could not staff the people. The doctor, what the patient needed could not be done in a vacuum. You need to have a nurse, you need to have a radiology tech, you need to have, and we didn't have that. And I had to wrestle with what was better for this mother and her new baby. These were not people of means. This was a waitress and her husband was a bartender. Had that mother been sent to Yale New Haven, she would have been separated from her baby. The husband would have had to make his own arrangements. And so I ended up probably doing what was not best medically, but in the entire picture, I think it was best for the father and the baby and the mother, and it worked out okay. But the point is, when we cannot adequately staff hospitals, people suffer tremendously. And that's about all I really have to say about that. And then again, that's not a one-off. In the past, I came close to the same problem. Always happens on Friday at 5 o'clock.
Elizabeth Hart. I'm a nurse practitioner for the hospice service at South County Hospital. I've been at South County for 13 years as a nurse practitioner with the hospice service. I echo a lot of the statements that you've already heard, so I'm going to refrain from repeating them. I, like Dr. Brady, have many stories of patients that have lack of access to primary care and have to utilize the hospital as their primary care. We have many patients that have not been able to get in to see someone, and unfortunately, it becomes too late. They've tried and tried, and they've been delayed in care, and when they finally make it to us, we're seeing patients that have advanced stages of cancer, have advanced stages of congestive heart failure, and they are left with these issues that could have been treated and identified with a primary care provider much earlier on. And I think at this point, it is a crisis in primary care. We do not have access. I have friends of mine asking me who can they see because their primary care, who they've had for less than 8 months, is now telling them that they're going concierge. And that provider was the provider for everyone in their family, and they're faced with spending upwards of $10,000 to pay for primary care, or waiting 6 months to a year to get into a new provider. At this point, we are not able to recruit providers because of rate parity, and I urge you to pass this bill. Thank you.
Any questions? Go right ahead.
Hi, I'm Tori Groves. I'm the Administrative Director of Nursing Operations at South County. I've been at the hospital for 16 years, and Dr. Brady pointed out transferring patients is difficult. We also see that in the emergency department with our behavioral health patients. They're staying longer because hospitals are closed, units are closed from nursing staffing challenges, provider challenges. This bill is critically important to recruit and retain the best clinicians to fulfill our mission and deliver high quality care and improved access to our community. Our vacancy rates are about 40% higher than they were at the beginning of the pandemic. Nurses have more opportunity than ever before to make higher wages for doing the same job by simply crossing state lines. That, coupled with Rhode Island's high cost of living, has made it an easy choice for staff. Please support this bill. It will not only improve the healthcare delivery system for our patients, but also strengthen the Rhode Island workforce.
Any questions for Tori?
Good evening, everybody. My name is Andrew. I am the Director of Surgical Services at South County Hospital in Wakefield, Rhode Island. I'm here today to share with you why the rate parity bill is not just legislation, it is truly a lifeline for our healthcare system. Here in Rhode Island, we're in a unique spot, quite literally. We're sandwiched between Connecticut and Massachusetts, where the grass seems much greener for many of our healthcare professionals, at least in terms of reimbursements and compensation. This disparity isn't just numbers on a spreadsheet. It's about real people and real outcomes. Talented doctors, dedicated nurses, and essential allied health staff are being pulled away from our communities just because we can't simply offer what our neighbors can. Imagine you're a specialist who spent years honing your skills, or a nurse who's dedicated your life to caring for others. Now imagine being told that just a short drive away over the state line you can earn significantly more for the same work. It's a tough pill to swallow, but sadly, many of our essential healthcare workers have made that drive, leaving our community's health hanging in the balance. I've been at South County Health in a leadership role for about the last 4 years, been there a total of 7 years. And within that relatively short period of time, I've seen many of my highly skilled and dedicated staff make that drive for simply a 20 to 30% premium. How can we compete with that? We cannot compete with that. No healthcare organization in Rhode Island can compete with that. Currently, I have a 35% vacancy rate in one of my most specialized positions in the operating room, surgical technologists. This has forced us to backfill these positions with travelers who all receive premium pay. Some of these travelers are highly skilled, as Dr. Brady can appreciate. Some of them are not. However, none of them have buy-in to our community or its members. This bill is our chance to change the narrative. It is about giving our healthcare professionals a reason to stay, to build their lives here, and to continue serving our community. More than that, it is about ensuring our families, friends, and neighbors have access to the best care possible without long waits or losing their trusted providers to the next state over. This bill is not just about competitive salaries or new technology, it's about people. It's about making sure that when someone you love needs care, the best possible help is right here in Rhode Island. So I ask you to consider the real-world impact of this bill. It is a step towards keeping our healthcare heroes close to home and ensuring our community remains strong and healthy. Thank you for your time.